as a pediatrician, you see a lot of postpartum moms. And I know that a lot of postpartum conditions, like mental health conditions like postpartum depression or even postpartum psychosis, they can be related to hormonal issues postpartum. Can you speak to that? What's been your observations with the moms in your practice?
Yeah, absolutely. I think, yeah, so I started getting into treating moms postpartum because, of course, the health of the child is very dependent on the health of the mother. So I would ask them how they're doing. And you could just see some of these moms are really struggling. A lot of anxiety, I'd say anxiety, panic attacks, even it can get as far as obsessive compulsive symptoms, maybe not full blown OCD, but just obsessive compulsive. A lot of times rumination, worry, and some of that is normal postpartum, right? Because your nervous system is supposed to be on heightened alert because you're trying to keep this little being alive, and that's super important. And it's a big job that no one's ever trained you how to do. And we don't get the kind of support that we used to do, like when we lived on farms and big groups, right? So some of it's normal, but people know when it's not feeling normal. And when you ask them the right questions, they'll let you know that it's kind of out of their range of even their baseline anxiety, which unfortunately people have too much to start off with. But so I started asking questions, and then, I would give them like, go get these labs done by your doctor. But most of them would come back and say their doctor didn't want to do the labs. So I just started ordering them myself. And what I found is that if it's really extreme, like the moms that are really struggling, there's a pretty decent high likelihood that their thyroid is off. Not like 50%, but maybe even 30%, I would say, anecdotally. I didn't write this down. I haven't done an exact research paper on this, but I would say anecdotally, the most, dysregulated moms that I see very frequently will end up having Hashimoto's or Graves' or a combination of the two.